Hello friends, today we describe about the action of the glucocorticoid, that is part 1. Now glucocorticoid, that is also called the cortisol, that is the life protecting hormone, and like aldosterone the glucocorticoid is also essential for the life but in different way. Aldosterone, that is a life saving hormone as it is related with the sodium, potassium and water homeostasis, while the glucocorticoid is a life protecting hormone because it helps to withstand the stress and trauma in the life. If we see the actions of the glucocorticoid, then first one on the metabolism. That is the action of the glucocorticoid on metabolism, that is occur in all the metabolism, carbohydrate metabolism, protein metabolism, fat metabolism and water and mineral metabolism. So we see one by one. First of all, the effect of the cortisol on carbohydrate metabolism, that is the stimulation of the gluconeogenesis, and it also causes a decreased utilization of the glucose by the cells. Both these causes an increased blood glucose level and that leads to the adrenal diabetes if the excess amount of the glucocorticoid is secreted. Now if we see how it is occurred, then cortisol that causes the stimulation of the gluconeogenesis by the two mechanisms. One, cortisol increases the enzyme that is required to convert the amino acid into the glucose in the liver cells, and second, the cortisol causes the mobilization of the amino acid from the extrahepatic tissue, mainly from the muscle and fat cells, and this amino acid then converted into the glucose in the liver cells. So this glucocorticoid often increases the rate of the gluconeogenesis as much as 6 to 10 folds than that of the normal. Now second mechanism, that is the decrease in the glucose utilization by the cells, and that is again via the two mechanism. Decrease, that is the one is the decreased oxidation of the NADH to NAD plus, which is required for the glycolysis, and glucose utilization by the tissue, and second is the it prevents the peripheral utilization of the glucose by inhibiting the phosphorylation as I described, and second action is the anti-insulinic action on the peripheral tissue. Both that causes increase blood glucose concentration, and here mainly glucocorticoid that causes increased glycogen synthesis also and inhibits the glycolysis, and all the glucose formation, that is the increased blood glucose level occurs, that is mainly due to the neoglucogenesis and not at the cost of the glycogen breakdown. If the glucocorticoid that is excess in amount that is secreted in blood in our body due to the any pathology that lead to the adrenal diabetes, and which is weakly sensitive to the insulin. Why? Because it has an anti-insulin action, but it is only when there is a pathology, there is an excess amount of the glucocorticoid is secreted, not in the normal physiological life. Now, action on the protein metabolism. The glucocorticoid causes a reduction in the cellular protein in all the cells except the liver, and that is why the various mechanism. First one, decrease amino acid transport into the extrahepatic tissue. So, cellular protein is decreased, depresses the formation of the RNA and subsequent protein synthesis in many extrahepatic tissues, especially muscle and lymphoid tissue. Third one, decreases their intracellular amino acid concentration, and fourth one, catabolism of protein in the cell continue to release the amino acid from already existing protein under the effect of the glucocorticoid. All these four procedures that causes a decreased protein synthesis as well as increase the catabolism of protein already present in the extrahepatic tissue cells, and that all diminishes the tissue stores of the protein. If the glucocorticoid that is in excess amount, then that lead to the muscle weakness due to the excessive protein catabolism. Also it decreases the immunity function of the lymphoid tissues. Now if we see the effect of the cortisol on protein metabolism in the liver, then it increases the rate of deamination of the amino acid by the liver. Second, it increases the protein synthesis in the liver. Third one, increased the formation of the plasma protein by the liver, and increased conversion of the amino acid to the glucose, and that is enhanced neoglucogenesis. So here in the liver, protein synthesis, that is increase, amino acid level, that is also increase, plasma protein synthesis, that is also increases, and that lead to the increase liver protein and increase plasma protein in the blood. And all the effect on the metabolic system of the body, that is mainly due to this all the procedure that is affecting the liver, and that will mainly due to the cortisol having a increasing enzyme formation for all above procedures. Now, third one, that is the effect on the fat metabolism. Mainly the cortisol having a lipolytic effect, means it causes the breakdown of the fat. Mainly it act via the permissive action on the with the epinephrine and norepinephrine, which also having a lipolytic effect. Mainly permissive action means it will potentiates the action of the other hormone, that is called the permissive action. And here the cortisol mainly decreases the glucose uptake in the adipose tissue, and the presence of the cortisol, the adipose tissue can't take the glucose inside the adipose cell, so that there is a no formation of alpha glycerophosphate, and that is required for both deposition as well as maintenance of the triglyceride in these cells. And you know that the triglyceride, that is the storage form of the fat, and that remains in the adipose tissue. So here, because of the not formation of the alpha glycerophosphate, this deposition and maintenance of the triglyceride, that is not possible, and that leads to the increase breakdown of the fatty acid, and that lead to the increase plasma free fatty acid level, and that free fatty acids are oxidized to give the energy or used to form the glucose in the form of the neoglucogenesis. Now mainly this cortisol that act as a fat users and glucose sparer, and this is seen in case of the starvation. So first the fat is used, and then glucose is used. Also the cortisol potentiate the action of the other hormone, means it as a permissive action along with the epinephrine and norepinephrine, other hormone having a permissive action with the cortisol, that is a growth hormone, glucagon and thyroid hormone. In the diabetic patient, what happened? The glucocorticoid that causes increased plasma lipid level along with the increased glucose concentration that is already present. Plasma lipid level that is also increases, that increases the ketone body formation and makes the diabetic worse. That is called the diabetic ketoacidosis. But in normal subject, what happens? Increased blood glucose concentration causes increased insulin secretion, which decreases the lipolytic activity by the lipases, and that counterbalance the hyperglycemia. The insulin that is having a main action of hypoglycemia, so it decreases the blood glucose concentration if it is increased. So here in the normal subject, it is a balance effect of the cortisol and insulin. Now action on the water and electrolyte metabolism. Slight mineralocorticoid action called the overlapping action that increases the sodium retention and depletion of the potassium by the kidney. So mineral like that of the aldosterone, it also causes the sodium retention and causes excretion of the potassium. Also affects angiotensinogen, that is secreted from the liver, that is also increases the increased synthesis of the angiotensinogen that converts angiotensin 1 into that converts angiotensin